Hello viewers, good morning to all. In this video, we are going to discuss about value clarification. I am K. Priyadarshini, working as a lecturer in MMM College of Nursing. The objectives of this video are define values in nursing, tell the definition of value clarification, enlist the steps of value clarification, explain the process of value clarification. Before going to value clarification, first we will say what is values. What is values in nursing? Values are the principles and the standards that nurses follow to ensure they are doing the ethical and quality work for the patient or client or the people whoever receiving care from them. Many nurses and nursing organizations share the values with a commitment to respecting their patient and providing excellent comfort, support and treatment through every area of healthcare. Importance of nursing values. Why we are studying values in our field? Because in nursing, values are fundamental one to practice nursing care to the person. These values only guide the standards for action, and it provides a framework for evaluating the behavior, and it influences the practice, and it helps in taking decision. And nursing is a profession rooted in ethical and legal values, and nursing performance is based on such values only. So it is very much important for the nurses to know about values to give quality and standard care to the receiver. There are many values and ethics in nursing field, but some of the values we consider as core values that everybody should follow that value. In nursing, we already discussed this. It is a profession rooted in professional ethics and ethical values, and nursing performance is based on such values. Nursing core values, it includes altruism, autonomy, human dignity, integrity, honesty and social justice. In this, altruism means how much they are taking care of other people, the caring and happiness, that we called as altruism. Human dignity, privacy, justice, autonomy in decision making, precision and accuracy in caring, commitment, human relationship, sympathy, honesty and individual and professional competency. These are all the core values. The core ethical values are generally shared within the global community, and they are a reflection of the human and spiritual approach to the nursing profession. If you see in the world, all the nursing personnel, they will follow this core values, so that the care received by a person is unique and the same type of care received by the people all over the world. In this slide, we are going to discuss about value clarification. Nurses often care for the client whose value system conflict with their own. See, in our nursing field, we are studying about many values. As well as a human beings, we are practicing many personal values also. Sometimes there is some conflict between the personal values as well as the ethical values we are following in our nursing field. In this case, the nurses itself in a confusion state that which kind of value we are going to implement for the person, in which value we are going to give more weightage. In that case, this value clarification is needed. And ethics and values, which are closely related, which both enlighten and complicate the nurses balancing the ethical principles of the client with those of the healthcare profession. So, nurses must understand their own values in order to practice ethically. Personal values or values internalized from the society or a culture in which one lives. So, people need societal values to feel accepted, and they need personal values to have a sense of individuality. There are many types of value: personal value, individual value, societal value, professional values. Yes, and professional values or values acquired during socialization into the nursing from code of ethics, nursing experiences, teachers, from the peer group. They are getting professional values. They are important because they influence the decisions, action, even nurses' ethical decision making also. So, as a nurse, we have our personal values, we are having societal values and professional values. In this case, while taking decision, the nurse itself in a confused situation, in that cases, value clarification is needed. The third steps in value clarification process is choose freely. Did you have any say in that decision? Do you have any choice? Choose freely. In this, the nurse has already given the list of alternatives. In that, make the patient to choose freely from the choices. The fourth step is feel good about the choice. Some people feel good after a decision is made. Others feel bad. How do you feel? See, from the list of alternatives, the patient now chosen one value, one choice. And in that choice, some people may feel good. Yes, I taken the good decision. But some people, they feel bad. No, I taken a bad decision. What is the person feeling? That we have to assess. The fifth step is affirm the choice. How will you discuss this with others? The family and the friends. Affirm the choice. The sixth one is act on the choice. Will it be difficult to tell your wife about this? Act on the choice. See, the client taken the decision and how they are proceeding with that decision. Okay, act on the choice. The seventh step is act with your pattern. How many times have you done that before? Would you act that way again? We have to think how many times you did that type of choices, and would you like to again you follow the same choices? These are all the things we should assess. Totally, there are 7 steps in value clarification. Already we discussed about this value clarification process in nursing, but again I want to include this value process in nursing. Values evolve and mature as experiences evolve and mature. Individuals are capable of arriving at values through an intelligent process of choosing, pricing, and acting. The first step is choosing. In this, the person has to choose freely from the alternative and after thoughtful consideration of the consequences of each alternative. Pricing, cherishing and being happy with the choice and willingly affirming the choice publicly. And acting, doing something with as a result of the choice and repeating this in some life pattern. In this, we already seen that value clarification steps process, and then we seen the value clarification steps, how they divided that 7 steps in this 3 main process steps: choosing, pricing, and acting. Okay, in choosing freely, we have to choose from the options, from the alternative, and after thoughtful consideration of the consequences of each alternative, in pricing, choosing and being happy with the choice, willingly affirming the choice publicly, and acting, doing something with of the choice, and repeating this in some life pattern. Here I want to discuss with example. The ANA, that is American Nurses Association Code of Ethics, provides a standard by which the nurse manager can assess the ethical issues in nursing. The way it addresses an ethical dilemma can vary in different situations. One ethical dilemma that can occur in healthcare facilities is when the nurse themselves are not properly equipped to complete their duties. See, here I am giving one example, that is nurses who notice their co-workers' lack of knowledge face an ethical dilemma of whether they should bring that issue to the nurse manager or not. To help the curb this ethical dilemma, the nurse manager can work hard to educate the nurses regarding the code of ethics, as well as educate them regarding the code of ethics for the specific medical facility. The nurse manager can also provide regular training for the nurses regarding recurring issues. See, in this situation, the nurse itself having the ethical dilemma that she noticed that their co-worker having the lack of knowledge, not able to give care adequately to the person. In that case, the nurse is itself having the ethical dilemma whether we can tell this information to the higher officials or a nurse manager, or if we are doing so, what kind of steps the nurse manager will take. If we are, if that person not allowing the co-worker to work, means again is the problem for the nurse to face the difficulty in shortage of nurses and other things. In that cases, the nurse manager has to make regular training for the nurses regarding the recurring issues in the ward. This is one more example for ethical dilemma or where the value clarification steps has to apply. See, this is between dilemma between honesty and withholding the information. Family members may want to withhold the medical information from the sick persons to protect their emotion. So they are requesting the nurses not to tell the truth to the patient. However, patients have the rights to know about the medical condition. See, in our nursing field, we have the value that we should inform the patient, we should give right information to the patient condition. Deciding how to share this information, especially if it goes against the family's belief, it can be a touchy situation for the nurses who take care of those kind of patient. In this, ANA advocate for truth telling or veracity as a key factor in nurse patient and relationship. So the nurse is in critical situation or ethical diplomatic situation, what kind of value I should give importance. In this situation, the value clarification process we should follow. One more example for value clarification, and this is the conflict between the science and the spirituality in the healthcare, which is science based and result driven, can impair religious or personal belief. Some religions restrict the medical interventions and the life-saving techniques. Nurses focus on providing medical care to reduce suffering and to allow the patient to concentrate on self-care. For patient or their family with strong religious and spiritual conviction, they focus maybe on adhering to the strict set of guidelines. In this, the ANA Code of Ethics state the nurses should respect the unique differences of the patient, including the lifestyle, value system, and the religious conflict. However, respect for the belief does not imply that nurse condones those beliefs or practices on a personal level. In this situation also, we should follow the value clarification steps under the process to take appropriate decision. Conclusion. To conclude, we seen the definition of value, the importance, definition of value clarification, importance, all those things. The value clarification helps you to get a clear picture of where you are going and what choices to make, what friends to have or avoid, what to look for in a relationship, and what career to choose and how to get there. Values are closely related to motivations, and counselors avoid the danger of passing on his or our own values onto their clients. When teaching the value clarification program, clients discover their own values. And value clarification helps a person to fulfill his need and find true happiness. We've seen the value clarification process, and we've seen the 7 steps in value clarification process. I hope you are all able to describe, able to explain what is value clarification system, what is value clarification process, and what are all the steps involved in this. Thank you for watching this video. Thank you.